Hello everyone. So today in this video we are going to discuss about a very important topic in anatomy, that is the brachial plexus. So if you know the brachial plexus by heart, you will be able to understand the whole upper limb, the nerve supply of upper limb. So without wasting time, let's start the brachial plexus. So roots of C5 to C8 and T1 are forming the brachial plexus. It's ventral primary rami only, not dorsal primary rami, but ventral primary rami. So if you will see the spinal cord has anterior root and posterior root. They are forming a spinal nerve which is having a dorsal primary rami and ventral primary rami. So all ventral primary rami of C5 to C8 and T1 will form the brachial plexus. So brachial plexus can be prefixed or postfixed. In prefixed brachial plexus there is contribution from C4 root also, but there is no contribution from T2 and very less contribution from the T1 root. In postfixed brachial plexus there is always a contribution from T2 also, but there is no contribution from T4 and contribution from T5 is less, right? So it can be shifted one segment up or one segment down. That is prefixed or postfixed brachial plexus. Now let's come to the main topic, that is the formation of this brachial plexus. So actually brachial plexus has 5 parts. It has roots, trunk, division, cords and branches, right? Root, trunk, division, cord and branches. Out of this, root and trunks are supraclavicular, right? Like they are located above the clavicle, right? Roots and trunk. Divisions are retroclavicular, so they are situated behind the clavicle, and cords and branches are infraclavicular, so they are situated below the clavicle, right? So first we have the roots. So C5, C6, C7, C8 and T1 roots. Now the upper two roots C5 and C6 are forming the upper trunk, okay? C7 forming is middle trunk and C8 and T1 are forming the lower trunk. Now every trunk is having two divisions, anterior division and posterior division, anterior division and posterior division, anterior division and posterior division, okay? Now the anterior division of upper and middle trunk are forming the lateral cord, okay? So lateral cord is formed by anterior divisions of upper and middle trunk. And then we have the anterior division of the lower trunk. Anterior division of lower trunk is forming the medial cord. And lastly, the posterior cord is formed by the posterior division of all the trunks, right? Upper, middle and lower trunks, posterior division are forming the posterior cord, okay? So this is the formation of division and cords, right? So we have roots, trunk, division, cord and branches. So lateral cord is formed by anterior division of upper and middle trunk, okay? Medial cord is formed by the anterior division of lower trunk, and posterior cord is formed by the posterior division of all the three trunks, right? Now let's see the branches of brachial plexus. So these are the branches from the roots. We have 4 branches from the roots. The first main branch is the long thoracic nerve, which is also known as nerve to serratus anterior because it is supplying the serratus anterior muscle, and it is also known as nerve of Bell because serratus anterior is helping in overhead abduction. So it is known as nerve to serratus anterior and long thoracic nerve, which has root value of C5, C6 and T1. The second branch is dorsal scapular nerve. So it is actually supplying the rhomboids, rhomboid major and rhomboid minor, so it is also known as nerve to rhomboids, the dorsal scapular nerve, which has root value of C5. We have some muscular branches to some muscles of the head and neck, like longus colli, the scalenus muscle, right? So we have muscular branches. And lastly we have the phrenic nerve. So actually phrenic nerve is originating from C3, C4 and C5 roots. Major contribution is from C4 root, but small contribution is also from C5 root. So phrenic nerve is also there in the branches from the roots. So 4 branches from the root. Which 4 branches? The long thoracic nerve, dorsal scapular nerve or nerve to rhomboid, muscular branches to longus colli and scalene, and some contribution to the phrenic nerve, right? Now let's talk about the branch from the trunks. So in the trunk we have only branches coming from the upper trunk. So there are two branches from the upper trunk, the suprascapular nerve and nerve to subclavius. Suprascapular nerve is supplying the supraspinatus muscle and infraspinatus muscle, while the nerve to subclavius is supplying only one muscle, that is the subclavius muscle. Both has root value of C5 and C6. Okay, let's see. These are the branches coming from the upper trunk, the suprascapular nerve and nerve to subclavius. This point is actually known as Erb's point because we are going to see Erb's palsy related to this Erb's point. Okay, so only two branches from the trunk, suprascapular nerve and nerve to subclavius. There are no branches coming from the division. We have branches from the cords, lateral, posterior and medial cord. So let's see the branches from the cords. Okay, these three are the branches from the lateral trunk, the lateral pectoral nerve, musculocutaneous nerve and lateral root of median nerve. Okay, so the mnemonic is LML. We can retain the branches from the lateral cord, lateral pectoral nerve, musculocutaneous nerve and lateral root of median nerve. This all three branches has the root value of C5 to C7. This lateral root of median nerve will join with the medial root of median nerve. This is the lateral root of median nerve, medial root of median nerve, and they will form the median nerve. Okay, so we have lateral root of median nerve. Lateral pectoral nerve will supply the pectoralis major and minor muscle, and musculocutaneous nerve will supply the muscle of the front of arm, and also cutaneous supply to the lateral side of the forearm. Okay, so this was about the branches from the lateral trunk. Now let's see the branches from the medial cord. These are the branches from the medial cord. We have medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and medial root of median nerve and the ulnar nerve. Okay, so let's see. So the mnemonic from the branches coming from the medial cord is MMMMU, 4M and U. Okay, so let's start. Which are the branches? Medial pectoral nerve, which is supplying the pectoralis major and minor along with lateral pectoral nerve. Okay, we have medial cutaneous nerve of arm, which is supplying the medial side of arm, the cutaneous innervation. Medial cutaneous nerve of forearm, which is giving cutaneous innervation to the medial side of forearm, as its name suggests, right? And we have medial root of median nerve, which will join with the lateral root to form the common median nerve. Okay, and lastly we have the ulnar nerve. Now one thing to notice, that all the branches, the 4M's is having root value of C8 and T1, but ulnar nerve is having root value of C7, C8 and T1. The C7 root is actually coming from the communicating branch, right? So this is the ulnar nerve, a communicating branch from the lateral root of median nerve is coming to join with the ulnar nerve. So that's why ulnar nerve is having root value of C7, C8 and T1. Okay, so these are the branches from the medial cord, and ulnar nerve is actually will actually supply the intrinsic muscle of the hand and also some ulnar flexor of the hand. Okay, so this was about the branches from the medial cord. Now let's talk about the branches from the posterior cord. These are the branches from the posterior cord. We have the upper subscapular nerve, lower subscapular nerve, axillary nerve, thoracodorsal nerve or nerve to latissimus dorsi, and we have the radial nerve. Okay, let's see. So this is the branches coming from the posterior cord. The mnemonic is ulnar. Okay, upper subscapular nerve, nerve to latissimus dorsi, lower subscapular nerve, axillary nerve and the radial nerve. Upper and lower subscapular nerve will supply the subscapular muscle, and lower subscapular nerve in addition will supply the teres major muscle. Okay, now to latissimus dorsi, as its name suggests, it will supply the latissimus dorsi. It is also known as thoracodorsal nerve. The root value is C6 to C8 in case of thoracodorsal nerve. Upper and lower subscapular nerve has root value of C5, C6. Then we have the axillary nerve. Axillary nerve has root value of C5 and C6. It will supply the deltoid muscle and teres minor muscle. Okay, and lastly we have the biggest branch of the brachial plexus, the thickest branch of brachial plexus, that is the radial nerve. The root value is C5 to C8 and T1. The radial nerve is actually supplying the back of arm, the muscle of back of arm, the tricep brachii, and it is also supplying the back of forearm, muscle of back of forearm. All 12 muscles of back of forearm will get supply from the radial nerve, right? So these are the branches from the posterior cord. See, so now we have discussed all the branches from the roots, trunk and cords. So if you enjoyed the video, please like the video, share this video with your friends, and please do subscribe to this channel. I will post more videos related with this topic, and I am also going to send a video about the clinical anatomy of a brachial plexus. You can check it out on my YouTube channel. Goodbye.